Hi there, this is Dr. Main Hasib, the accreditation consultant and quality and safety trainer with lesson 3 and the last lesson and the subtopic of introduction to general safety. In lesson 1, we covered the following. What is safety? Why safety? Is your lab a safe place to work in? What are the general hazards in a laboratory, safety policies and procedures, and safety training. In lesson 2, we cover safe work practices review by risk assessment, and we talked about the why, the how often, by whom, and how. Also, we covered the safety and lab accidents, and under that topic, we covered why accidents happen, how to manage and minimize accidents or risk, and general safety rules in the laboratory. And then we talked about also disaster preparedness, the internal and the external. Also, we covered the evacuation plan, bloodborne pathogens, TB exposure plan, and infectious disease reporting. In this lesson, lesson 3, we'll cover also a very important topic, PPE provision, instructions, and usage, to wear or not to wear. And we'll have a brief introduction for you. We'll talk about the selection, and under the selection, we'll talk about latex allergy, talk about training for the PPEs, when to wear gloves and dirty lab coats, when not to wear gloves, when not to wear dirty lab coats, and a subject summary. So let's start with lesson 3. Personal protective equipments, PPEs, to wear or not to wear. Okay, you will find the requirements for the PPEs in LabGen 74100. That's LabGen CAB checklist. Okay. Under this topic, we'll give you a brief introduction, selection of PPEs, training, when to wear gloves and dirty lab coats, when not to wear gloves, when not to wear dirty lab coats, and a subject summary. In Lab Gen 86500, it says PPEs are items that do not permit blood or other potentially infectious material to pass through or reach the employee's work clothes or skin, etc. And the standard also says appropriate PPEs, gloves, gowns, masks, eye protections, etc. are provided. Provided by whom? Provided by the laboratory. Are provided and maintained in a sanitary and reliable condition in all technical work areas in which blood and body substances are handled and exposure is likely to occur. So the employer should provide PPEs for the employees. Then the employees, the staff, need to wear the appropriate clothing and PPEs for the situation. Okay. Apron may be required if exposure to large volume blood fluid is anticipated. OSHA requires the gloves to be worn with each patient contact and change after contact when performing vascular access procedure, except when drawing voluntary blood donors. So when you are drawing patients for testing, you must wear gloves and you must change gloves between patients. But when you are drawing blood, it's a voluntary drawing blood for blood donations, you don't have to change gloves between donors. Personnel are instructed in the proper use of PPEs. Instructed, that's mean training. Also, same standard, Gen 86500 says footwear must provide adequate protection. Next, we're going to talk about selection of PPEs. You will find the requirement for the selection of PPEs in CAB LabGen 76300. It says personnel use the proper PPEs devices when handling corrosive, flammable, biohazard, and carcinogenic substances. Such devices may include gloves of appropriate composition, aprons, and eye protection. Shoes or shoe cover must protect the entire foot in areas where splashing is expected. Also, gloves should be selected on the basis of hazard involved. And here I'm giving you the different type of gloves for different situations. Nitrile gloves protect against most chemicals and infection agents. Rubber disposable gloves, and these are the most common gloves that we are using in healthcare and in the laboratory. Okay, they're used for handling infection objects, protect against mild corrosive material. Neoprene gloves protect against most solvent, oil, and mild corrosive materials. And heat, cold resistant, these are when you are dealing with extremely hot or extremely cold items or things. You need to use what they call a mesh glove or cut resistant glove. Use heat resistant glove when handling hot items. Wear insulated gloves when accessing ultra cold, like minus 60 to minus 80 degree stuff. Latex allergy. There is a standard in the LabGen about latex allergy. You will find that in LabGen 77700. It says the lab has a written program, so you need a policy or a procedure to protect personnel and patients from allergic reactions from exposure to natural rubber, latex in gloves and other products. The program should address at least the following elements: selection of products and implementation of work practices that reduces the risk of allergic reaction. The provision of education program and training material about latex allergy. So it should be part of your safety training checklist. Evaluation of current provision and control strategies whenever a worker is diagnosed with latex allergy. What usually we have a liner for them, okay? They wear some sort of white cotton gloves first, and they put their rubber gloves on the top if they have allergy to that. That's how we dealt with this situation before. Or you get them rubber-free gloves. So how to comply with this standard? You need record of employee education training on latex allergy. And like I said, I'm recommending that will be part of your safety training checklist. And you need record of evaluation of the plan when appropriate. That's, of course, as needed and as applicable. Mask. White cone mask, N95 or N95 approved mask, full face with filters. For glove selections, guidelines on mask and PPEs and glove selection, you can go to these two websites if you'd like to get more information. Next is training, safety training. And you will find this in CAB LabGen checklist standard 74200. It says personnel are instructed in the proper use of PPEs, whether they're gloves, gowns, or masks, or etc., whatever they need in order to do their job. The required elements of training in the use of gloves include proper fitting of gloves. If your hand is large, don't use small gloves. Or if your hands are small, don't use large gloves. Use the right size for your hand. And the employer is supposed to provide different sizes of gloves of gloves according to their staff. If the majority is small hands, you have to have a lot of small glove boxes, okay, for example. So the required element of training in the use of gloves include the proper fitting of gloves, replacing of gloves immediately when torn or contaminated, not washing or disinfecting gloves or reuse. They're not usable. When you're done with them, you throw them away. Using hypoallergic gloves when indicated by patient or healthcare provider history. Decontamination of hands after a glove removal, and you find this in Lab Gen 74250. Also, you need a procedure for the use of PPEs for a special task and record of personal training for PPEs. How? You need to have an employee roster in your lab, in your laboratory. Include on it all of your staff. And then when somebody is trained or a group of staff trained, then you put the days when they were trained. Okay? This way you will not miss anybody, especially those who work off shifts or weekends or on the night shift. When to wear the gloves and dirty lab coats. That's the next thing we're going to talk about. So when to wear gloves and dirty lab coats. What do you mean by a dirty lab coat? Doesn't mean need to be washed, but dirty because we use it in the dirty area. It's a clean lab coat or a special lab coat, okay, used to work on the bench to deal with contaminated stuff. That's why we call it dirty lab coat, because you could have a clean lab coat. A clean lab coat is used outside of the bench, outside of the laboratory, in a clean area, like going to meetings or going to the cafeteria or going to offices, clean offices. Okay, you don't have to have a clean lab coat. You could go out with your street clothes, but if you want a lab coat to wear when you are outside of the lab, it has to be a clean lab coat. A clean lab coat that is not used on the bench. Okay? So when to wear gloves and dirty lab coats? When working with chemicals, biological and hazardous material. When working on the bench means doing patient testing or things related to it. When drawing blood. In case of an accident, okay, it is much faster and easier to remove a lab coat than street clothes to minimize skin contact with hazardous materials. When not to wear gloves. When touching common clean surfaces such as the telephone, computer, and doorknob. For the telephone and the computer, by the way. If they are in a dirty area and you use next to a bench and you need to answer the phone or you need to enter the result using a computer, that cannot be a clean phone and a clean computer. And you need to answer the phone fast, okay? And if you are testing and resulting at the same time, you're going to take your glove all the time to enter in the computer. So these computers and phones that are in the dirty area, on the bench, next to the bench, next to the instrument, cannot be classified as clean areas or clean items. Okay, but if in an office, in a clean area, in a conference room, you cannot go with the gloves and touch these items. If you are going outside of the lab, even if those transporters, or if you want to take a specimen from one section to another, and you have to walk through a hallway, you don't wear gloves. You have to take your gloves off in the section, okay? You put the items in a container or in a bag, a biohazard bag, then take your gloves out, take gloves with you, and when you reach the other section, okay, if you are required to take these items out and put them in a rack, for example, or in a refrigerator, then you wear gloves again, and you take them out, and put them in a rack or in a refrigerator. Transporters, when they are transporting specimens from phlebotomy to the main lab or to a central area, they cannot wear gloves between phlebotomy and the central area, especially if it's far. Okay, they have to remove their gloves and wear gloves again when they are dealing with the specimens again at the section or at the lab. Okay, I already told you that. When not to wear dirty lab coats in public and clean areas, like I told you earlier, such as offices, lunchroom, lounges areas, or elsewhere outside the laboratory. No, do not take lab coats or launder lab coats at home. Your employer should provide for you laundry service, whether in-house or outside. When I was in America, we used to have a company who comes and take the dirty lab coats and wash them and bring us the lab coats. That's why each staff should have 3 dirty lab coats. One on them, one on in the locker room, okay, and one in laundry. So one on them, one in the locker room, and one in laundry, just in case the one in laundry that you have an accident, then you have an extra lab coat to wear. This is a video that I'm gonna play and show you on the proper glove removal. It's a short video, but it's a good video.
Proper glove removal. Follow these steps to prevent the spread of pathogens. Pinch the first glove at the wrist and pull down, touching only the outside of the glove. Ball up the removed glove in the palm of your gloved hand. Slide an ungloved finger inside the other glove, touching only the inside with your ungloved finger. Peel the second glove off inside out, trapping it in your palm. Discard the balled up gloves in the proper receptacle. Clean your hands with soap and water or alcohol-based cleaner.
And this is just a picture and an instruction on how to remove your gloves. Okay, you use the right hand to remove the left glove. Don't touch the skin. Pinch the outside of the glove, and when you're done, you put it in your left hand. Then you use a clean hand. You put your fingers inside the glove because it's clean, and you turn it upside down, and that's what you get, and then you throw it away. And this is another video on the personal protective equipment. It's a good video. It's about 5 minutes if you'd like to watch it.
Personal protective equipment is designed to protect against infections. Personal protective equipment acts as a barrier to prevent or limit contamination of skin, mucous membranes, or clothing of staff in order to prevent transmission of potential infectious agents. The sequence for donning personal protective equipment is designed to prevent and control transmission of microorganisms in the healthcare setting. The steps are: 1. Perform hand hygiene. 2. Gown. 3. Mask. 4. Eye protection. 5. Gloves. Hand hygiene is considered the most important and effective infection prevention and control measure to prevent the spread of infections. Before donning your personal protective equipment, wash your hands. Step 1. Wet your hands with warm water. 2. Apply soap to produce lather. 3. Rub hands together for 10 to 20 seconds. 4. Rinse. 5. Dry your hands with a paper towel. And 6. Turn off the tap with a paper towel. If you're using an alcohol-based hand sanitizing product, ensure it contains an alcohol concentration of 70 to 90%. The gown is to fully cover your torso from neck to knees, shoulders to wrists. Wrap it around the back and secure it with ties at the neck and at the waist. If the gown is too small, use two. The first ties in front, the second in back. There are various kinds of masks and respirators, but each is worn in a similar fashion. Medical face masks are loose-fitting and are designed to filter some of the wearer's exhaled organisms to reduce exposure to others. Respirators are tight-fitting and require certification from the National Institute for Occupational Safety and Health. They are designed to filter inhaled organisms to reduce exposure to the wearer. For respirators, be sure to use an appropriate size mask as determined by approved fit testing. With clean hands cupping the outside of the mask, place the mask over your nose, mouth, and chin, securing it to your head with ear loops, ties, or with the elastic straps to ensure a snug, secure fit. Place the upper head strap around the back of the head above the ears. Place the lower head strap around the back of the neck below the ears. Do not cross the straps. Position the flexible nose piece over the bridge of your nose, shaping it to fit. Adjust the mask so it is snug to your face and extends below your chin. For respirators, perform a seal check. Position eyewear over your eyes and secure to your head using the earpieces. If you wear eyeglasses, put them on first, then don your eye protection. If required, the face shield should fit over the brow. Gloves go on last. Insert your hands into the gloves and extend the gloves to cover the cuffs of your gown. Keep your gloved hands away from your face. Avoid touching or adjusting other personal protective equipment. Limit surfaces and items touched. Remove gloves if they are torn. Always perform hand hygiene before putting on new gloves. All personal protective equipment must be removed in sequence and discarded carefully. Proper removal is important since equipment is now contaminated. The steps are 1. Glove removal. 2. Gown removal. 3. Perform hand hygiene. 4. Eye protection removal. 5. Mask removal. And 6. Perform hand hygiene. The outside of the glove is dirty and must be removed with care. Grasp the outside edge of the glove at the inside of the wrist and peel away, turning the glove inside out. Hold it in the opposite gloved hand and slip a finger under the wrist of the remaining glove. Peel off from the inside, creating a bag for both gloves. Discard immediately into the waste receptacle. The gown front and sleeves are dirty, so it must be handled from the back and inside. Starting at the neck, unfasten the ties. Peel the gown in a forward or downward movement and away from the neck and shoulder, turning it inside out. Fold or roll into a bundle and discard. Perform hand hygiene before proceeding. The outside of the eyepiece is contaminated, so handle eyewear by the earpieces. Pull away from your face and place into a designated receptacle for cleaning. Personally owned eyewear may be cleaned by the individual. The front of the mask is dirty. For removal, handle only the ear loops, ties, or elastic straps. Remove the mask from your face by bending forward and pulling the mask forward in a downward direction, allowing it to fall away from the face, then discard. To complete the process, perform hand hygiene one more time. Remember to perform hand hygiene anytime you suspect your hands are contaminated during removal of protective equipment. Let's review all of the steps for putting on and taking off personal protective equipment. First, perform hand hygiene. Put on your personal protective equipment in the following order: gown, mask, eyewear, and gloves. Remove your personal protective equipment in the following order: gloves, gown, eyewear, and mask, remembering not to touch contaminated surfaces. Perform hand hygiene after removing gloves and gown, and again after taking off eyewear and mask.
So, in summary, PPEs, in summary for the PPEs, are the last line of defense against a hazard. They prevent contact with the hazard. Different types available for different situation or different hazard. Your motto should be everyone goes home safe and healthy every day. Now I'm going to give you a summary of practices for handling biohazard material. Wear protective equipment. Wash hands after handling hazard material. Perform procedure carefully to reduce splashes. Keep hazardous material in a safety cabinet or hood. Use mechanical pipettes devices. Don't use your mouth. Never eat, drink, smoke, apply makeup, or handle contact lenses in the lab. Decontaminate lab services before and after use. Document that, okay, and initial it. Be careful when using sharp. Dispose of sharp properly. Use secondary leak-proof container when transferring hazard material. Decontaminate hazard waste before disposal. And read the SDS safety data sheet before working with chemicals. I am done with this subject. I'm done with lesson 3 on the subject of Introduction to General Safety. For the next subject, please go to Safety in Clinical Laboratory, the complete guide, and we're gonna talk about fire safety in clinical laboratories. Thank you for watching.